I want to open us all with just a moment of intention, whether that is prayer for you or silent contemplation. I want to invite you to take just a moment and think about what it is that brings you to this really important work today. So I'll just open that space for you for silent reflection or prayer. And in my tradition, we say, Amen. Well, good evening. My name is Brent O'Neill. I am the pastoral resident of Church on Main. We are blessed to be sponsoring this event today. We will be covering a whole lot of resources today in just a teeny tiny bit of time. And so we will be looking really hard at Brandywine Counseling's new services and also at the Hero Help program and SN4C. Sergeant Saunders and we're going to tie up any loose ends because there's just a wealth of information. But thankfully, the real work is not here tonight. The work is how we can get people connected to the resources that will help them. And so with that, Rebecca, I invite you to take over. You are now my co-host, and I'm glad to have you.
Wonderful. So I'm going to do this right and share my screen. Hi, everyone. I'm Rebecca Nuttall. I'm the Prevention Program Manager at Brandywine Counseling and Community Services. So I thank Brent for inviting Brandywine Counseling to be a part of that, and going to do a little overview of substance use disorders that will tie right into Harm Reduction 101. So substance use disorders, they're defined as a mental health disorder that affects a person's brain and behavior, leading to a person's inability to control their use of substances, such as legal or illegal drugs, alcohol, or medications. Substance use disorders occur when the recurrent use of alcohol and or drugs causes clinically significant impairment, including health problems, disabilities, and failure to meet major responsibilities in their day-to-day life at work, school, or home. These symptoms can range from moderate to severe, with addiction being the most severe form of an SUD. These can affect all walks of life, all age groups, all races, genders, ethnicities, socioeconomic backgrounds. Unfortunately, it does not discriminate. So substance use disorder and co-occurring disorder is definitely a very common term in our world. And research has found that about half of the individuals who experience a substance use disorder will also experience a co-occurring mental health disorder. Some of these common co-occurring mental health disorders can include, but are not limited to, anxiety disorders, depression, ADHD, bipolar disorder, an array of personality disorders, as well as schizophrenia and some more. Some common risk factors are genetics. There's definitely a lot of research that suggests that certain genes may run in families that can contribute to certain mental health disorders, as well as certain substance use disorders. There's also environmental factors such as stress and trauma that can cause genetic changes that are passed down through generations. Mental health disorders. Studies have found that individuals who are diagnosed with mental health disorders, such as anxiety, depression, especially PTSD, may use drugs or alcohol as a form of self-medication. Brain changes in people with mental health disorders may enhance the reward effects of substances, making it more likely that they will continue to use the substance. Substance use disorders can trigger changes in the brain structure and function that make a person more likely to develop mental health disorders. Also, some additional risk factors are early childhood development issues such as abuse or neglect. If anyone on here is familiar with the ACE, that definitely the higher number of ACEs, which is the adverse childhood effects, the more likely they are to use substances. Also lower self-control, and anger, frustration, alienation, or hopelessness are all risk factors that can lead to substance use disorders. So what are some tools that we need? Obviously, prevention, that's what we're all here for, is to spread this prevention message and to educate. We also offer early intervention, trying to get on the early side of it. Treatment is also wonderful, and advocacy. What does the research say? It says a lot around intensive, long-term, multi-dimensional programs are more effective than short-term, one-dimensional programs. Programs that involve support systems like your family members, your parents, your siblings, the community, social peers, churches, are more effective than programs that target individuals in isolation. These programs must target the need of the specific individual, and it's definitely not one size fits all. The delivery of services must be meaningful and coordinated. A systems of care approach is a very effective with this population, and motivational interviewing is an effective tool for therapeutic information gathering. So now to move into harm reduction. Harm reduction is a set of practical strategies, intervention, and ideas aimed at reducing negative consequences associated with substance use. This is done without necessarily extinguishing the problematic health behaviors completely. Harm reduction is also movement for social justice built on a belief in and respect for the rights of people who use illicit and licit substances. Harm reduction also accepts, for better or worse, that illicit substance use is part of our world and chooses to work to minimize its harmful effects rather than simply ignoring or condemning them. Understanding that substance use is complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe abuse to total abstinence, and acknowledges that some ways of using substances are clearly safer than others. It establishes the quality of an individual and community life as and well-being, not necessarily cessation of all substance use, as the criteria for successful interventions and policies. And it calls for the non-judgmental provisions of services and resources to people who use substances and the communities in which they live in order to assist them in reducing harm. So it's basically our entire Syringe services program is really based around a harm reduction model, which basically means we meet people where they're at. And sometimes that means, a lot of times it means, especially with Syringe services, that they're not quite ready to stop using those substances. So we want to reduce the harm to themselves and the community by offering clean syringes and connection to care when they are ready, and making that connection that so many people are missing. Harm reduction also ensures that substance users and those with a history of substance use routinely have a real voice in the creation of programs and policies designed to serve them. It affirms substance users themselves as the primary agents of reducing the harms of their substance use, and seeks to empower users to share information and support each other in strategies which meet their actual conditions of use. It recognizes the reality of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequities affects both people's vulnerability to and capacity for effectively dealing with drug-related harm. It does not attempt to minimize or ignore the real and tragic harm and dangers associated with licit and illicit substance use. Harm reduction incorporates a spectrum of strategies from safer use to manage use to abstinence to meet substance users where they are at, addressing conditions of use along with the use itself. Because harm reduction demands that interventions and policies designed to serve substance users reflect specific individuals and community needs, there's no universal definition or formula for implementing harm reduction. I think that's a really important part, that it's not a one size fits all. It's just about meeting them where they are. Harm reduction is also about respecting the rights of people who do use substances, a commitment to the evidence, and a commitment to social justice, and collaborating with networks of people who use substances, really to strongly avoid the use of stigma, which so often plagues this community. Goals of harm reduction are to keep people safe and alive and encourage and support positive change, to reduce the harms of drug laws and policy, to offer alternative approaches that seek to prevent or end substance use, to address discrimination against substance users, to reduce and prevent overdose, to promote harm reduction interventions such as syringe access, safe needle sites or safe injection sites, as well as naloxone, which is a really important overdose reversal medication, and to make sure that we make everyone aware of the implementation of Good Samaritan laws, which we do have in Delaware. So here's just some of the references that I used, and I encourage everyone to take a look at. The National Institute of Mental Health is a wonderful resource, as well as SAMHSA, which is the Substance Abuse and Mental Health Administration Services. Services Administration, I apologize, I see a typo there, and as well as the Harm Reduction Coalition. And there's just my contact information, but I can make sure, Brent, I put that in the comments as well. All right, now I have to stop sharing. Okay.
Thank you, Rebecca. Rebecca, could you share a little bit about the time and the type of things that people are able to do at the Syringe Services program?
I definitely can. Thank you. That's a great segue. So Brandywine Counseling and Community Services is happy to offer a syringe services program at the Church on Main in Middletown. We're there every Friday from 8:30 to 9:30. And some of the services that individuals can access is 100% anonymous. It's free to sign up. You do have to have a participant card. And what it will do is protect from the prosecution of syringes if someone does get pulled over by law enforcement. The actual having syringes on them is something that will protect them from not the substances but the actual syringes. From there, it's a one-to-one exchange. So someone comes with syringes and they're able to get clean ones along with harm reduction materials, which would just be the materials that they use to put together their drugs before they inject. We also offer rapid free HIV and Hep C testing. Right now, because of COVID, we're also able to offer free at-home rapid HIV tests, which is a really nice addition because they are really quite expensive if you buy them at Walgreens. We also offer fentanyl testing strips, naloxone, which would be the overdose reversal medication, pregnancy tests, connection to care and treatment. If someone is willing and wanting to enter, we offer referrals to Brandywine Counseling, to detox programs, to inpatient facilities, to whatever would meet their needs, as well as referrals to other social services. And really just a friendly face and an encouragement that there is life on the other side. And when they're ready, we're there to help guide them along the way. And if they're not ever ready, that's also okay. And we're there to help them while they're moving through everything.
Wonderful. Thank you. Thank you so much. For those who didn't catch it, they are in Church on Main's parking lot on Fridays from 8:30 to 9:30 a.m. Right there in that nice little van. Next, we are turning over to Dennis to tell us a little bit about the COPE Mobile Clinic.
Hi, everybody. My name is Dennis Vermel. I am the program coordinator for our COPE 2 program at Brandywine Counseling. We are a mobile treatment service. We do a lot of harm reduction, a lot of the same services as Rebecca, with the exception of syringe exchange. I'm going to share my screen with you guys.
One second, let me give you that power.
Okay.
The special power only
please.
Certain people can handle. There.
Right. I saw that. I was like, oh, wow. All right. Come on. All right. It's not going to let me, for some reason, it's not letting me share. It could be because I'm using an iPad versus a laptop, but that's okay. I will, anybody that's interested, I have a PowerPoint and I will share it with you all via email if I am given your emails in the comment box. So basically, I want to share a little bit about myself because I grew up in Delaware City, which is only a hop, skip, and a jump from Middletown. Uh, Middletown is where me and all my friends would come and get our drugs, whether it was marijuana, pills. That's where I was introduced to drugs, and that's where I would get most of my drugs from. My drug dealer wasn't the guy out on the street who, stood on the street corner. My guy lived in a 3-story house, very well to do. It was not somebody that you would believe was dealing drugs. Father was a lawyer, mother, she had a really good job. I don't remember what she did. But those were, some things that I experienced in Middletown. I still have friends who are struggling, who live in the Middletown, Townsend, and Odessa area. And recently I had a friend pass away from overdose, was clean for some years and then relapsed. And because of the type of drugs that are out on the streets nowadays, it's a completely different world. It's almost asking for overdose, unfortunately. And more recently I've been posting on Facebook, our flyers, our times that we're going to be out there. So one of the things we've had to combat in Middletown is stigma. There is a lot of negative stigma about treatment. Many of the things that we hear are, you're just substituting one drug for another. You're just bringing more trash to our town. These were some of the things that we had to combat. And I actually had to turn off comments to a lot of the posts that we would make to avoid having that stigma. And I'm always open and willing to have a conversation with someone who maybe doesn't have the education about some of the things that we do. So some of the services that we provide on COPE is obviously we do referrals to the needle exchange. We've had a couple of people that we have referred there recently that had asked questions. And oftentimes our RV actually gets mistaken for the needle exchange, which is okay. It always gives us an opportunity to just meet people and talk to them about the services that we provide. We offer outpatient services, which includes counseling. It's all individualized. We offer groups, which they can do via Zoom from home. We also offer e-prescribed Suboxone. Suboxone is a medication that helps to reduce withdrawal symptoms. On top of it has extended release naloxone in it, which also helps prevent them from continuing to get high. Individuals will come to the RV. They will complete an intake. The only thing that we need from them is their insurance and their ID. If they don't have insurance, we will help them apply for insurance through Medicaid or Medicare if they are eligible. With Suboxone, we also do Vivitrol, which is extended release naloxone. So again, they complete an intake with us, and they are offered individualized counseling. As many sessions as they want. They can be as many as once per week and as little as once per month. Additionally, we have them check in with a peer specialist at least once a month. So they're at least getting talked to twice a month. And then they also have the opportunity to meet with myself. I am a licensed counselor, as well as I have a lot of experience in this field. I've been working in this field for 13 years. I started when I was 20 years old. So to give you an idea, I've worked for pretty much every major organization until I got to Brandywine, and Brandywine has been my home. They are, it's one of the first organizations I've had the pleasure of working for who really care about the community, and all they want to do is help communities continue to grow and prosper and not watch our loved ones continue to go through their struggles and lose their lives. Trying to think if I'm missing anything else. We offer rapid HIV and Hep C testing. Again, we also have the take-home HIV test, which I actually looked it up the other day, and at Walgreens, they run about $40 to $50 for the oral swab. So we're talking about getting something for free. It's a free service. We also do naloxone. I am a trainer, so I will meet with people. I will sit down with them, and even when we hand out the naloxone, I try to make sure that everybody knows how to use the naloxone, and that they're confident in using it for themselves or for others. Um, Again, we came to Middletown with the hope that we can help and help build the community, help reduce all the drugs that are out there on the streets, all the people that are struggling with addiction, and try and fight some of the stigma that in some of these older rural towns, because that is the biggest barrier to people getting into treatment is stigma. Um, Again, we accept everyone. Doesn't matter race, sexuality, presentation, it doesn't matter. We accept everybody as they are, where they're at, and if they're ready for treatment, awesome. If they're not ready for treatment, we'll sit down, we'll have a conversation. Even if we have to have 1,000 conversations, we will try to get them into treatment, or at least try to get them to a point where they're healthier. In essence, harm reduction. We also do case management services that focus on housing, that focus on employment, that focus on getting food stamps. You don't have to be a part of COPE to go and get some of these services either. You don't have to complete an intake for us to try and help you with housing. We'll apply you through the Delaware State Housing Authority, and then we'll make sure you have all the information so you can continue to follow up independently. And the same thing as far as getting food stamps, applying for Medicaid. These are just services that we've done, that we've helped out with, and this has helped us get people to come back and say, hey, I need treatment. We do have a couple of success stories that I want to share with you guys, because I think it's important that not just talk about our services, but also talk about our success stories. I just had a guy who completed his Suboxone detox. He's been on Suboxone with the COPE program for 2 years, negative drug screens for a year and a half. And he completed, and he has no more probation. He has a full-time job. He has his own apartment, and he's really excited to start the next chapter of his life. And part of his self-care is continuing treatment. He decided to continue treatment elsewhere, a little closer to home, but he's still going to continue with treatment even without the medications. We've had people who have started with us on the COPE mobile vehicle, who then transitioned to methadone in clinic, who are now doing amazing. We've had a lot of people be very successful on these medications, and I'm a walking success story. I started off on methadone, I transitioned to Suboxone. I was on Suboxone for a few years, and it worked for me. I've been medication free now for 5 years. It's great to know that these things really work. And a part of that is also, having a support staff, working with the needle exchange. I've got to meet the staff there, and they are awesome. Non-judgmental, and we've had clients come to us and say, hey, needle exchange told us to come check you guys out. And, the same thing, we try to keep the same atmosphere. We're non-judgmental. We accept you as you are. And if you decide you don't want treatment at this time, that's okay. Hopefully you come back and you see us again. So we actually had a guy who was doing well, relapsed, left treatment. And then today, knowing where we were going to be located in Georgetown, he came out and he re-engaged with us. And now he is back in treatment, and, just as motivated as he was before. And I'm really excited that we can continue to provide services in Middletown and just the surrounding areas. I'm hoping that we can get people from, the surrounding areas, Townsend and Odessa, to come out and also be a part of this and just build a stronger community together. So thanks, Brent.
Thank you, Dennis. I'm very grateful for the work that you're doing. And the COPE Mobile Clinic is at Church on Main from 9 to 11 a.m. on Wednesdays. Very grateful for that. So up next, we have Shamir representing the Hero Health Program. And I have a PowerPoint from you all, but I'm not sure, I know things have been switched all around, so I don't know if you want that PowerPoint, if you have it on your computer. Oh, we can't hear you.
Sent you, but I have one on my end too.
Okay, I can give you that power if you'd like.
Okay. Let's see. Okay, cool. All right, so my name is Shamir, and how do you make, sorry, I never did this before. Oh, there we go. Oh, I heard it talking. Okay, so sorry about that. So I'm with the Hero Health Program with the Newcastle County Police Department within the Behavioral Health Unit. We have a mental health unit who they go out and they respond to the 911 calls that come in when someone's having a mental health crisis. I'm on the addiction side, so I'm the licensed mental health professional. We also have a child advocate, a nurse, a case manager, and we all work together to pretty much combat the drug use that's going on in the community. So as you can see, the program is a free voluntary program. We also work with multiple treatment providers. We have many relationships with different providers in the community, including we have some individuals with Brandywine. We have connections with rehabs, such as Tenzia, Keystone, other rehabs that may be, out in other states. We also have good connections in Florida. We actually sent someone to Florida today to get treatment. We have a few people down there as well getting some treatment. We have a good relationship with RCA. And we're able to also provide individuals with scholarships who may not have insurance, or the facility is good, but the facility doesn't accept their insurance. So we work to get those people where they need to be. And of course, the goal of our program is to sustain, the recovery, improve a person's overall lifestyle, and of course, also assist individuals like family and friends who have been impacted. So I'm trying to get it to stop talking. I'm sorry. Okay. So the eligibility is you have to be a Delaware resident, of course, an adult. You have to have, substance use or mental health, or it could be co-occurring. You don't need insurance to enter our program. However, some of the treatment providers need you to have insurance, but we do work with them and are able to, help with that Medicaid application if needed, or, assist with, as I said, getting scholarships. They don't also have to have involvement with the criminal justice system. However, we do have some participants who may have like low-level charges, for lack of better words, and in some instances we can advocate for them, just say, hey, they're getting treatment. Sometimes the charges can be reduced. There are some charges that, because it's a police department, we're not able to provide advocacy, but we still do provide like help if they need treatment and things like that. I'm sorry, I can't get to stop talking. So as I said, we work with all providers. So how we get our, okay, I'm just gonna talk. I'm sorry, because the slideshow keeps talking. Sorry, it's been like a long day with helping a participant, so it's a little stressful today. So how we get our participants is we get a like an overdose list. I want to say every day, and we'll get one probably tomorrow morning, and we have our nurse or myself will go out to the community and we'll respond to those non-fatal overdoses. So we'll go to the person's house just to see, if they're interested in treatment, what's going on. the nurse will talk to them from the medical point of view, and then I'll talk to them from the mental health side. Sometimes we also take our child advocate, which is Andrea, out because she works with the family, so she can provide resources for the families if they need help with childcare, diapers, whatever necessities they may need for their children. We are Christiana Care employees embedded in the police department, so we have access to the Christiana medical care and their resources as well. And then our case manager, she oversees the active participants. So once they do agree to be in the program, they sign up, we figure out their level of care. We may have to send them to detox or inpatient, such as like Rockford or Meadowwood, just for, clinical and stabilization. So once we do that, we work with those facilities to coordinate the next level of care, which in most cases is rehab. So we, do an assessment on the individual, try to get to know their needs, and we figure out which facility would be the best, to suit them. And then we work with our, the other agencies that we collaborate with. We work with them to get the individual to the rehab. For example, the guy that we had going to Florida, he didn't want to be in Delaware, just felt like he needed to get away from everything. So we had an opportunity to get him down to one of the Florida facilities that we work with. So he'll do that. We use Keystone because they do co-occurring. So we use them a lot. We have a good working relationship with them. And we follow the individuals, throughout their treatment journey. So we don't just, dump them at rehab and then that's it. We do weekly follow-ups. We get weekly progress notes, phone calls if anything has gone wrong or, there's something needed. We work, like I said, in collaboration with wherever they may be to try to make the experience better. We also work closely with PEP, which is, I think it's called, it used to be Parents Empowering Parents, but now it's People Empowering People, I believe. And we refer the family members to them because, this affects not just the individual, but the family too. So we refer like parents and sisters and, brothers to them because they've been through, what the family's going through. So what better way to assist them with support than someone who, has been through it and knows how to help them. So we work really closely with them and refer over to them. We do outreach a few times a week, even if there's no overdose list. We still go out to check on our current participants. We go to NET a lot to just, talk to people and see if they need anything or we can be an assistance with treatment services. What else do we do? I'm trying to remember everything. I don't think I forgot anything. Yeah, I think I got everything.
Perfect. Thank you, Shamir. I'm really grateful for the work that you're doing. And next, representing SN4C, we have Tamsin.
Buddy, good evening. Shamir, when you said, I think I got everything, it wasn't any shortage of anything. There's certainly a lot that you all are doing. So that's awesome. And please forgive me for joining at 7:30, wrangling some children with bedtime. So hopefully they all stay where they should be. So thanks so much. My name is Tamsin Lavanoff. I work with the Southern Newcastle County Communities Coalition, and many names on the call support the cause down in the Middletown, Odessa, and Townsend area, which is substance abuse prevention, primarily for youth, but of course, that wraps around to the family. And so, the purpose for us to be on this call was to also share some resources that are available, and primarily, in this instance, would be medication safe disposal, right? And how do we get rid of medication safely, effectively, and often. So there's a handful of, not a handful, there's one 30-second video, one 1-minute video that Pastor Brent is going to kindly share. And the first one talks about counting, locking, and dropping your medication, which is an easy acronym: count it, lock it, drop it.
Don't let your prescription medicines contribute to the drug problem in Delaware. Count it. Count your pills once every 2 weeks to prevent theft and help ensure medications are taken properly. Lock it. Lock up your medications and store them in a secure place that others would not think to look. Drop it. Drop off your unused or expired medications for proper disposal at drop boxes located in participating law enforcement offices or pharmacies. Visit DelawareHealthyHomes.org for more information.
We have a problem with unwanted pharmaceuticals in this country, and Deterra has the solution. Using our patented Deterra system, everyone can safely deactivate prescription drugs anywhere in the world. It's a convenient, cost-effective way to help prevent abuse and contamination. Simply place unused medication in the environmentally friendly pouch. Fill halfway with warm tap water. Wait 30 seconds. Seal tightly and gently shake. Then put in the trash receptacle. Using NAT12 molecular absorption technology, proprietary activated carbon bonds to pharmaceutical compounds, rendering drugs ineffective and safe for disposal. It's that easy. Everyone has a role to play to solve this problem. Do your part today and get Deterra from Verde.
Awesome, Lisa. Thanks for sharing about using them. I don't know in the chat if you want to say if it was easy or not easy. I'm kind of curious to know what your experience was with it. That was 2-part. So the first one is very easy. Love it. Love to hear it. The first part was the count it, lock it, drop it. So that's a campaign that was created, not by us. We had purchased the rights to kind of create a video around that specifically for Delaware. And that was shared far and wide. And basically it's trying to get, that piece out to remind everybody that, medication is easily accessible and that we should be mindful of where we're keeping it and to keep ourselves and our loved ones safe. And so in the instance, in case, someone might be in recovery, that we want to also be sure that we have a way to dispose of medication if we are prescribed any. And so taking them, counting them, being mindful about them is kind of like a drop the campaign. And then the second one is the Deterra, which has to do with these bags. I would be super prepared if I had one. I'm just going to do this because it's right here. And so the top, you rip open the top and it basically, as the video showed, meds go in, warm water halfway, seal it, shake it. And if anybody caught any of that science, then your science knowledge is above my pay grade here. But so there is some molecular technology that's supposed to neutralize and deactivate this medication, deeming it okay to go into the regular trash. And so that then, removes that barrier of being able to dispose of it, in the trash. So those are available, as Pastor Brent had just pulled up, those are available in the Middletown area specifically, as we're talking about these zip codes, by the following places. So our Daily Bread, the MOT Senior Center, and I'm sure I would probably be redundant. I'm sure maybe some of the access to this information will be available later, but Church on Main, Pastor Brent and his folks there are also toolkit trained. Tree of Life Lutheran Church, which is actually in Odessa. Thank you, Dennis. The COPE van also has these on board. Master Sergeant Saunders, of course, over at the police department, if you can come in and ask at the front desk. Pastor Scott Berkeley, I don't know if the Sunshine Rotary Club is actually operating live right now, but they are also toolkit trained. And so a toolkit was to be able to get these materials distributed into the community. Great question, Dion. So Deterra bags through those toolkit recipients in the Middletown area. If you or your organization, I know Brandywine Counseling is trained, and Dennis just mentioned that they're on the COPE van, but yes. So if anyone is an organization that would like to be trained, actually, Mr. Upperman, Rockford Center, they're also trained as well. And so being able to disseminate these. And then last but not least, yet another way of getting rid of our unused, unwanted, and expired medications, pet meds, vitamins, and all the above is also, look at this. I feel like this is just so nice. Thanks, Patrick. The year-round, 365 days a year, police departments are open anytime that they have hours. These are the locations statewide. And if you can see, they are listed by county in each column. So Newcastle, Kent, and Sussex. And they, including Walgreens. And of course, this list continues to grow. And exactly, it's nice to, yeah, fantastic, Lisa. That's a great point. And yes, and the CVS in Middletown, which we do advocate to get this list updated as often as possible and make sure that folks are aware of it. So those are the year-round ones. And speaking of the state drug take-back day that Lisa just alluded to, there happens to be one that's coming up Saturday, if you can believe it. So I don't want to steal the thunder from Master Sergeant Saunders, because I'm sure he will make a strong plug for at least our Middletown Police Department location. But twice a year, so for folks that can't or don't want to access a police department, or maybe a Walgreens is not accessible to them, they tend to be the larger Walgreens, like the 24-hour ones are usually the ones that have the box, which is why not all Walgreens and the CVS that was just listed there. So, okay, yes, Dion, we'll make sure that that you guys get a copy of that one. And oh, fantastic. Talking and reading is apparently not my strong suit. Anybody else?
Okay.
Okay. Okay. Sarge is telling me to go ahead regarding the take back day. I'm sure he'll have some other tidbits to add as far as what the police department's doing, but we at SN4C, being a roundtable community-based coalition in the Middletown area, have some fantastic partners, and Middletown Police being one of them, including Rockford Center, Brandywine Counseling, Hero Help, and many others on the call. And we are helping host the spring DEA RX prescription drug take back day. And specifically in Middletown, there will also be the opportunity to dispose of used or unused sharps or syringes, which is not a typical thing that happens at the take back. The DEA is not the ones taking those back. We have a partner agency that is a for-profit company that does medical waste for their business, and they have partnered with us, and will take their sharps back. And also, we're also promoting the fact that vape devices, Juuls, e-cigarettes, mods, and all of those are also available with the batteries removed. So that's our pitch for the spring DEA prescription drug take back, and hoping that we get lots of folks out. We'll have lots of resources there. Radio station's going to come out, and there'll be a 2-hour Naloxone training that we're looking forward to offering as a resource to the community members in the area to come out. It's longer than I thought it was going to be. Sorry, guys. Thanks.
Oh, wonderful, wonderful. Thank you so much, Tamsin. We also have, this is the first announcement, we will have Naloxone training at Church on Main Thursday, May 20th. So that is in a month. From 7 to 9 p.m. It'll be in person. It might be outside if it's, nice outside, but we are bringing that training, and you are able to get Naloxone kit provided by the Delaware Division of Public Health there. All of that information is on our website, churchonmainde.com/drugs. It's also on Facebook, and it is in this PDF that I've put in the chat. I do want to turn over now to Sergeant Saunders. He's just, oh, there, I don't know if I see your shoulder, Sergeant Saunders. And I want to invite, if anyone has any questions, to put them in the chat now while Sergeant Saunders helps us tie up any loose ends. We can't hear you.
I know you're aggressive with that mute button. How's everybody doing? I'm Master Sergeant Scott Saunders, Middletown Police Department. I just want to commend Dennis for sharing his testimony with everybody, and I'm looking to hook up with Dennis so we can do some things, because we need to not only educate the community, we also need to educate our officers. as to what addiction really is. And I just want to say from the Middletown Police Department perspective, we're all partners in this. So I can speak to the great work that Pastor Brent is doing, Brandywine Counseling, Hero Help, SM4C, Rockford Center, and we have other partners that aren't even on the call that are doing a tremendous job. Let me just speak to my experience the last 5 years. I've been a part-time addictions clinician. And I do that, and that's one of the most exciting things that I do every week when I meet with, I don't call them clients, I call them the family, you know. But again, they're regular people, like Dennis alluded to earlier. It doesn't matter your socioeconomic status. It doesn't matter your gender, race. It's non-discriminatory. Drugs don't discriminate. But I will say that to those that are on the call that are just listening in, that this will not be the last forum that we will do, correct, Pastor Brent? But I'd like to see more families on these calls, because the families are the support system for those that are suffering from substance abuse. They have to be able to come out here, get these resources, understand what treatment is about, so they can convey that to their loved one. As far as from the police side of things, Hero Help, speaking on that, we're partners with the county, and the Hero Help program is a wonderful program. As far as Southern Newcastle County Coalition, prevention is the start, you know, education and prevention. As a police officer and a clinician, I will tell you that a lot of people that are suffering from addiction, legal troubles go hand in hand with addiction. So we have to be partners, everybody on this call and others, to really increase our chances for success. It's a situation in our society today that we can't arrest our way out of the problem. So we have to come up with ulterior programs like Hero Help and other programs to increases our chances for success. So Middletown Police Department, we're totally committed to this. I think that everybody on the call kind of covered most of what everybody is doing around substance abuse in the Middletown area, but we need to get more people involved. That's what I see. More people, more of the community, more of the, especially the religious community more religious community need to be involved. Other civic organizations need to be involved, because it impacts all of us. You know, it's not one person that doesn't know somebody that's suffering from addiction. And most of us have somebody in our family, somebody close to us. So with that, I'll turn it back over to Pastor Brent.
Thank you so much, Sergeant Saunders. I want to make sure that we cover all of the agencies that we have here. And so if there are any other agencies that have a resource to share, raise your hand, unmute. Let me do that now. And if there's any questions, please just put that in the chat real quick. And I see Eric Upperman from Rockford. I'll invite you to unmute.
Thank you. Thank you again for the invite. The Rockford Center is a psychiatric hospital. We serve patients and members for the geriatrics. We do a free assessment 24 hours a day, 7 days a week. We have an adult IOP program. We have a partial program for our children. So in the Middletown area, we will provide transportation for patients that are attending the IOP and a partial program.
Wonderful. Thank you so much. And I will make sure we get some information about that in our packet here.
Sure.
Seeing no questions, I am just so incredibly grateful for all of the many resources that we have here. And so I want to give you a preview for this packet. Here's a table of contents. You can tell I am still in school mode in finals week right now. But this, let's see, how many pages? 15-page packet has a lot of stuff in it. It's all of the information that we've shared today and many more, including sobriety support groups like AA and NA and Code Purple Recovery and Attack Addiction. So all of this information is available on our website. It was put in the chat and I'll put it back in the chat. And with that, blessings as you go. I'm very grateful to have you all. And may we continue this vital and important work. Amen.